All right, welcome everybody. We are going to get started today with today's Virtual Pathology Grand Rounds. And on behalf of the Virtual Pathology Grand Rounds Committee and ASCP, it is my distinct honor to introduce our speaker today, Dr. Nicole Jackson. Dr. Jackson is a board-certified associate medical examiner for Kings County in Seattle, Washington, with a clinical assistant professor appointment in the University of Washington's Department of Laboratory Medicine and Pathology. She's a graduate of Duke University, go Duke, and Tulane University's Schools of Medicine and Public Health. Dr. Jackson completed her anatomic and clinical pathology training at Louisiana State University Health Science Center and her forensics pathology fellowship training at the New Mexico Office of the Medical Examiner. She was a top 6 honoree in the American Society for Clinical Pathology's 2021 40 Under 40 and is a fellow in multiple professional societies. Her interests include deaths in vulnerable populations, medical education, quality improvement, mentoring and community outreach, diversity, equity, and inclusion, increasing the visibility of forensic pathologists, and using population-based data to reduce the number of preventable deaths. We at Virtual Pathology Grand Rounds and ASCP are delighted to have her presenting to us on death during the pandemic.
All right. Thank you for the introduction and thank you for having me. All my handles for social media are down there on the left, as well as my email for anyone who would want to reach out and follow up to me after this presentation. So 3 learning objectives for today's talk. The first is to not only define excess mortality or excess deaths, but also be able to state the number of excess deaths that occurred in the United States since the start of this pandemic. The second is to describe how this pandemic disrupted overall death trends within our country. And then the third is to compare and contrast trends within and between our different manners of death throughout the pandemic within the US. So I had the unique experience of living in 3 very different regions through this pandemic. I started in Albuquerque, which is a statewide office at the onset of the pandemic, so during the panic phase. The majority of the pandemic I spent in Chicago, which is a large urban office. And I recently relocated to Seattle. So now I'm starting to see the effects as we resume our new normal. So what is excess mortality? So it's an epidemiologic term, and it just refers to the number of deaths above what is expected or predicted if we were in normal, usual circumstances. Simple calculations, excess death equals reported deaths minus expected deaths. And for those who don't know, deaths are fairly predictable. So this is a graph taken from a subset of the CDC, the National Center for Health Statistics. And you can see going back to 1920, it's a fairly linear increase in deaths over time as our population grows and ages. And then you see we hit 2020, 2021, and we have a near vertical increase, very steep. Death is also seasonal. So a lot of us have worked in hospitals and we might have anecdotally noticed, a lot of people tend to die right after the winter holidays. Well, this is true on a national level. You'll see a little dip in the summer. And then when you hit December, January, and February, we do usually have a bump. That is until 2020 and 2021, where you can see it was kind of all over the place and elevated the entire time. This is a headline taken from the New York Times, and I thought it was a really good way to open this presentation. 2020 and 2021, incredibly deadly for our nation, but COVID wasn't the only culprit. Certainly the most talked about, and you can see COVID kind of in the background, light gray, numerous deaths. But we have all these deaths from other causes that were above and beyond what was expected during this time. That's really going to be the focus of the presentation because a lot of these deaths fall under our jurisdiction as medical examiners, coroners, forensic pathologists throughout the nation. It's important to note that what we see, these trends, they're patchy, right? They're aggregates of data across the nation. And so not every region was hit the same, not every city was hit the same, not every demographic. And this is a point I'll be talking to for different deaths over the course of the presentation. So what were the mortality rates during the pandemic? I pulled this from the New York Times page, which keeps an up-to-date log of real-time counts of not only cases, but deaths. So we are approaching 1 million deaths in the United States. Of those, about 500,000 each year, so 500,000 in 2020, 500,000 in 2021, were considered excess deaths, so above and beyond what we would expect. This has never been seen before, certainly not on this magnitude and certainly not this long. And of those excess, over 208,000 were non-COVID related. It's interestingly to note of the COVID related ones, about 91% are estimated to be directly from COVID, with the other 9% or so as not directly related to COVID. So not a COVID pneumonia, not a pulmonary thromboembolism due to COVID, but a poor relationship where the decedent was infected with COVID, maybe had a ton of comorbidities, and then subsequently died. And you can't ignore the temporal relationship with that initial infection. Of note, these excess deaths not related to COVID, that's also where the importance of public health interventions come in, right? Because as time goes on and people have antibodies either from having COVID directly, from being vaccinated, or unfortunately from dying, that background, all those COVID deaths are going to decline. But what I'm talking about today, these have been sustained trends over the past 2 years. So these are what we now need to focus on as a nation and a community. So we'll start with homicides, one of our manners of death. Homicides are deaths from an intentional act by one person, either to cause harm, fear, or death. So during the pandemic, as we all know, we've all been under extreme sustained uncertainty. We had housing crisis, economic crisis, racism, political conflicts, people losing their jobs, people wondering how they're going to care for their children, their elderly loved ones. And it was bad for all of us. We're all traumatized. It was a time of a lot of fear, sadness, anger, and anxiety. And anger, it's one of those basic human feelings and emotions, right? It signals that we are threatened, we've lost something, we're deprived, and then aggression is acting out on that. And we have seen a lot of that over the past 2 years. Top on my mind when I think of aggression and unnecessarily violence, certainly so much hate against Asian Americans during this time. And of course, not all hate crimes result in death, but some do. And when they do, they come to us as medical examiners. And so in 2020, and I don't think the data has been aggregated yet for 2021, but in 2020, specifically hate crimes against Asian Americans rose 76%, which is huge. Also increased with African Americans, also saw a 40% increase in 2020. Certain Jewish communities as well. Only 22 murders were reported as hate crimes. I would suspect that's an underestimation because a lot of times we do not know the motives behind why one person has killed someone. Sometimes we do, but oftentimes we do not. Also seen by many of us throughout the country, these seemingly small incidents that just trigger an exaggerated reaction by someone. So you see someone kill their neighbor after wandered on their property. A snow shoveling fight turned into a murder. Definitely, I think we've all seen road rage escalate during the last 2 years. I know a small child was killed out in California during an unfortunate road rage shooting event. I know personally, I've seen just people out in the club, someone stepped on their shoes, and next thing you know, they were killed. We've had multiple cases through the offices I've been at where road rage, people got out of their car to physically attack someone, and then either got run over by someone else or shot and killed. So people are not in a healthy space, and it's being reflected. 2020, and it's looking like 2021 is not doing too much better. It was a bad year for homicides, our highest increase in our nation's history for multiple decades. And so the graph on the right is showing many major cities, with Chicago being on the left and Denver on the far right. And nearly every single city saw an increase in homicides if you compare 2019 to 2020. Cook County, where I was at for a majority of the pandemic, surpassed 1,000 homicides. Hadn't done so since the early 90s. And they have an interesting feature here. They have a heat map where you can go, it's publicly available, and map where all the crimes occur. And as you can see, it was pretty much over the entirety of the county. And I think a lot of us have seen that wherever we live. It's no longer violence localized to one location. It's starting to spread. It's going to more, quote unquote, what used to be the safe areas. What's interesting when we look at what rose, it wasn't all crime that rose, it was specifically murders and specifically gun-related violence, which is a fairly unique problem the US has struggled with historically, but especially in recent years. So it's estimated that 4,000 extra murders were committed in 2020, and most of those were gun violence. A large part of that, there was a huge surge in purchasing of guns, especially at the start of the pandemic. There were over 40 million background checks in 2020. That's a 40% increase from 2019. That represents about 22 million guns purchased in 2020, so a 64% increase. And this is only what we can trace. We have guns that are being shipped in illegally, guns purchased from the internet that can't be traced. And what's interesting is 9 out of 10 weeks in 2020 were the highest ever in the history of reporting for background checks. So 9 out of 10 weeks, historic highs since 1998. And it doesn't seem like it's really slowing down in 2021, which is concerning. Another large part of this are ghost guns. So ghost guns, they're pretty much untraceable firearms. A lot of their components are made with 3D printers. They do not have serial numbers on them. They're shipped to consumers who then assemble them and then use them. Sometimes they use them on themselves accidentally. We've seen this with children getting hold of them and ordering them online, thinking they're toys, and then accidentally killing themselves. They're also intentionally bought to commit crimes, assault. They're very prevalent, not only in Chicago, but a lot of the coastal states with tighter gun laws, because again, you don't have to undergo background checks and no one can really trace that you have it. And the way they were able to get around a lot of this, there were loopholes because they weren't considered a firearm proper, they were just components. However, I think possibly good news recently, the federal government has responded that now they're trying to push, and we'll see how far this goes, that these components will be engraved with serial numbers that will allow tracing if a crime were to occur, an incident to happen, and now imposing background checks. But this has all been proposed, nothing is finalized. Unfortunately, a lot of our children died during the pandemic due to gun violence. And so it's multifactorial like everything, right? So just like our daily schedules were disrupted, so were our kids. They were staying home, they weren't going out with their friends, spending time on the internet. We had a lot of kids getting hold of guns that their parents had purchased and not secured and accidentally shooting themselves or someone else. Again, teens buying these ghost guns. And then with the reopening of schools, we started seeing school shootings again. South Carolina had the highest number of school shootings they've ever seen. They had 9 previous to that. Most they had was 3 in maybe 2019, and then 1 preceding that. So that's a huge increase. And the CDC is saying rates of gun deaths in kids 14 and younger have increased by 50%. So this data is from, it's an organization I like, it's Gun Violence. They are not-for-profit. They are nonpartisan. They just collect daily data on gun-related violence and publish it and let people do with it what they want. So this is comparing the last 3 years, and you can see all gun violent deaths, all causes have increased slightly, with homicides increasing in the pandemic. We jump down to mass shootings. Again, there's a little bump during the pandemic, but what's the biggest concern or biggest alarm for me, if you look to our kids, so the first group is if you're 0 to 11, And the second one are your teenagers, 12 to 17. Well, 0 to 11, they went from 210 killed to in the 300s. And then for your teens, it was a huge jump from 780 to over 1,000 to over 1,200. That's a lot. So now our accidents. So our accidental deaths, those are deaths from an injury or poisoning, think drugs, with little or no evidence that there was any intent to cause harm through the injury. So I'm not intentionally drugging you, and I'm not intentionally drugging myself to end my life. So we'll start with our fatal drug intoxications. This is a recent headline I stumbled upon as I was making the presentation, so I thought I'd throw it in. They have recently aggregated data, and it shows that teen overdose deaths have rapidly increased, but it's really not because more of them are using drugs. So if any of you are familiar, these are the blue M30 pills we're now seeing everywhere, and these are illicitly made usually on the black market, maybe cartels, and they're fentanyl and acetaminophen or Tylenol mixed together. So this was some research conducted mainly centered in LA, and they looked from January 2010 all the way through June of 2021, and they analyzed overdose deaths in our teen populations during this time. And the numbers are really staggering. So you can see the first two columns, 2010 to 2019. So that first decade, the rate was about the same. The top is our overall population, which saw an increase, but our teens really didn't. In those 10 years, it was around 500. Then you jump to the pandemic, and we basically double, right? You're near 1,000 deaths in 2020 and over 1,100 in 2021. And what are the drugs that are causing that? The answer is fentanyl, 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 fentanyl. And you can see here that first decade, fentanyl was toward the bottom. And just like the rest of the nation saw an increase and then a huge jump during the pandemic. Interestingly, they also decided to and the two populations that saw the largest increase were your American Indian or Alaska Natives, and then your Latinx population here and here. Very concerning. And I should add in, it's not that more teens were using, it's just that the drugs they're using had fentanyl, which is very lethal. This is an article I happen to be reviewing on my own, and I thought it'd be good to include. We basically have 4 waves of the opioid crisis, and we are currently in waves 3 and 4, which are overlapping and arguably somewhat the same. So the first wave was the late 90s to 2017. Those are your prescription opioids. It's really come down a lot. That's not what we're seeing now. And a lot of that, there have been a lot of programs, a lot of education, what our doctors are prescribing, how people are taking them. Heroin saw an increase from 2010 to 2017. It has since faded. And what's really come to dominate are your synthetic opioids, your fentanyl analogs. From 2012-ish on, what we're also seeing is concomitant use of your stimulants, methamphetamine and cocaine, in addition to fentanyl. And that's a regional thing as well. So where I'm at, West Coast, there's a lot of methamphetamine. When you talk about East Coast, Midwest, you start to get more cocaine as your stimulant of choice in conjunction with fentanyl. So I'm currently at the King County Medical Examiner's office. We have a very unique office in that most offices don't do this. Our investigators go to scenes, that's common. But what's different is if there are drugs, drug paraphernalias, they will collect them as evidence, seal them, and bring them back to our office. And they are able to test them immediately for a large list of potential drugs. Same time, we perform the autopsies, we collect urine, we collect blood, and we can test them and compare for comparable drugs. And we can say in real time what people are dying of. And we do still send it out for confirmatory testing, but we don't have to wait 1 month, 3 months, 6 months to get an answer back. So this is all real-time surveillance. And what you can see, if you start at this graph, you can clearly see all of a sudden 2020 and then 2021, a huge jump. And this purple is that opioid and stimulant. So your fentanyl, and where we are, methamphetamine. You can see how big that purple bar has expanded, especially actually last year, 2021. In 2022, this is only through March, is not looking too much better if we multiply that times 4. Coming down here, you can see fentanyl is pretty new to the West Coast compared to the rest of the nation. And you can see that, the early aughts, late aughts, almost non-existent, and then a sudden and steep increase. Same thing with methamphetamine. Heroin, which used to be popular here, has really come down. So what does the national data say? The national data says over 100,000 people fatally overdosed on drugs between April of 2020 to April of 2021. That is an all-time record 12-month high. In 2020, that calendar year, 92,000 people died of overdose deaths. And that was an increased rate of 13%, which is incredibly high to see. And really not surprising, people staying at home, dealing with their anxiety, their fear, also drug supply chain problems, people just putting more fentanyl in things. And since 2015, the overdose deaths have been rising rapidly in Black and Latinx communities. And that's something that really hasn't garnered much attention. But why is there so much fentanyl everywhere? One, it's cheaper to make. It's more efficient to make it and manufacture than heroin. The internet has really helped facilitate distribution, communication, and our supply chain has just diversified. So it used to be China, Mexico, now India's coming in. So it's coming in from everywhere. So fentanyl and its analogs. So fentanyl, it's an opioid. It's anywhere between 50 to 100 times more potent than heroin, as depicted in this picture. It's cheap, easy to make, and then they have all these analogs. Carfentanil popped its head up a few years ago. It's kind of come down. What we're seeing more is fentanyl, maybe acetafentanil, parafluorofentanyl, but mainly fentanyl, and then plus or minus some more fentanyl of some sort. We also saw a ton of natural disasters in the last 2 years. So 2020 on the West Coast, you had these thunderstorms that ignited wildfires, also maybe gender reveal parties. It's called a derecho in the Midwest, which is winds, tornadoes, hail, rain, and then 7 different hurricanes hit the Southwest United States in 2020. And all these deaths, they come to us as medical examiners. King County, as well as Oregon, Northern California, and then up into Canada, saw a huge unprecedented heat wave that resulted in many deaths, some of which are continuing today. I know I've recently signed some death certificates of people that have basically been in the hospital since last summer. So the final death count is unknown, but a lot of excess deaths during this time. In 2021, we saw the heat wave. We all remember the winter storm in Texas. Again, Hurricane Ida, which not only rocked the Gulf Coast, but then traveled up to the Northeast, causing flooding, tornadoes in the middle of the country. And again, all these deaths come to us. Suicides. This was an interesting point of discussion, very contentious during the pandemic. A lot of people were arguing and politicizing suicides and hypothesizing, well, if you do quarantines, you're going to, suicides are going to go up and vice versa. But let's look at the data and see. So this is back from the previous slide on gun violence archives. You can see overall suicides, at least gun related, don't really seem to change. And a lot of headlines say suicide declined during the pandemic. But it's not necessarily true depending on who you're talking about. So this is a graph of suicide by race and ethnicity. You can see the top, historically, American Indian and Alaska Natives have had a high rate of suicide, followed by that, the whites, and then kind of everyone else has historically been lower, but that has been changing and it really hasn't garnered much attention. And so when you start stratifying your variables and looking at different demographics and different geographies, things change. So in Vegas, that's the Clark County Coroner Medical Examiner's Office. They saw during the pandemic a rapid and very concerning increase in the number of suicides in teens. So in 2019, in that entire year, there were 9 suicides. From the start of the pandemic to June, they saw 6. And then an additional 12 in the second half of the year. The youngest child was only 9 years old. I was reading a lot about this. The principal, she said she was getting calls so often. She was sitting in her car, crying, didn't want to answer her phone. And so there were conversations that were had about, is it worth it to keep our schools closed in this area if we are losing our children? Another demographic that's often overlooked, is race. And if you don't stratify by race when you're dealing with something like suicides, which historically in the US has been, the burden has been on white male, it can overshadow trends in smaller populations. And so the Office of the Chief Medical Examiner in Baltimore, Maryland, which is a statewide office, in conjunction with researchers at Johns Hopkins, they decided to study just this. So they reviewed over 1,000 suicides, and they studied 2 things: race, ethnicity, and the date of death. And they made 2 important historical breaks in their timeline. March 5th was the first case that was reported in Maryland. And when that case was reported, it was an immediate statewide emergency declaration. Things closed. May 7th, that's when things began to reopen. And as you can see, the difference in suicides, so it decreased in your white population, but it actually increased in the Black population. And this mirrors the burden of cases in the region of COVID, as well as the deaths during this region. Again, something not often discussed or analyzed, and I looked for multiple reports and really didn't see anything. Similar story in Chicago. We saw a lot of Black decedents who took their own life during the pandemic, even though supposedly, Black people don't commit or die by suicide, but we were seeing it. In that same trend, suicides in whites decreased. And a lot of attention was not paid to this, as you can see in this headline, and then not much was done in response to that. Continuing, so I was studying this, I was looking at this, it was something of interest to me. All these articles talked about communities of color compared to whites, and they would talk about Blacks, they would talk about Latinos, they would talk about indigenous populations, and nothing was said about Asian American populations, which I think is wild because if you look, this is one of the most recent years we have data, again, national data from the CDC. The #1 cause of death in Asians ages 15 to 24 is suicide. And so I think it's very problematic. This population is repeatedly left out of this conversation, left out of all these analyses. And I can't even comment on what happened, during the pandemic for this population. All right, jumping ahead to our next category, natural deaths, or deaths due solely either to disease or aging. So interestingly enough, this is a paper and it's showing red are your deaths directly related to COVID. Purple, the only one that somewhat mirrored it was cardiovascular disease. And we did see an excess rate of deaths in a cardiovascular disease, and hypertensive cardiovascular disease, and ischemic cardiovascular disease. But many different diseases saw an increase above what was expected during the pandemic. Diabetes is one of the highest. I know we've seen a ton of diabetics who died at home during the pandemic. A lot of time, especially early on in the pandemic, but also during the multiple waves that occurred, and people either not wanting to seek care because they were afraid of going to the hospital, being unable to seek care because hospitals were packed, there were no beds, and they did not want to wait in a waiting room where it was risky. They could, catch COVID. They were already at higher risk because they were diabetics. But interestingly enough, the same thing for Alzheimer's disease and other dementias. They saw a higher um, rate of death during the pandemic. Reading a lot about this, it seems, the isolation component and the social isolation, as well as, having your daily routine disrupted if you're someone that has dementia, profound effects. Hypertension, other pneumonia that's not COVID pneumonia, coronary artery disease, stroke, all these things went up. And of course, some of these are probably due to COVID, because as we all know, there was a point, not everyone that wanted to be tested could be tested. And so I'm sure a certain percent that we will never quite know is attributed to COVID. But even without that, many natural diseases increased during this time, and many came to us as medical examiners. This is a paper I thought was interesting. It was out of Michigan, and they studied temporal relationship of the pandemic over time, mental health and substance abuse. And the big take home here is that alcohol mortality increased for all groups, specifically related to complications of long-term drinking. So your cirrhosis, your profound electrolyte disturbances that cause death, not acute intoxications where your alcohol levels like 800, but the ones that fall in your natural disease categories increased. There's some special groups I wanted to consider, but I don't think we talk about fairly often. So the first, law enforcement. So law enforcement during COVID, they had an increased amount of deaths during this time. The leading cause of death was actually COVID-19. Firearms were the number 2 cause of death, and then your traffic related fatalities, which encompass multiple things. So in 2021, they saw a 55% increase in line of duty deaths. So 458 died in the line of duty in the past year, as compared to 295 in 2020. That's the highest on record since 1930, ever. COVID-19, as I just said, remains the leading cause of death, even still. What's interesting to me, they saw an increase in traffic-related fatalities, which makes sense. If we think about the first year and a lot of people weren't on the roads, a lot of people were staying at home. And then you fast forward to the second year where things are more open and things are driving. Well, unfortunately, a lot were in this classification of struck by fatalities. So hit by a car or something to that effect while they're pulling someone over or directing traffic or something to do with them accidentally getting struck by a moving vehicle. So they saw a huge increase in the last year of 38%. 84 died from felonious attacks or assaults, most involving firearms. Some were traffic related, most again being those struck by, but also sometimes in pursuit of someone or usually somebody that's intoxicated, which is it's just very sad. Followed by blunt force, so being beaten by somebody with something, and then sharp force, you think knives. So this is a group, this is all publicly available. It's called First Help. And so I was curious to see what suicides look like in this population, because I know it had been increasing for years, and that's why this group was started back in 2016, I believe. And they not only do law enforcement, they do all first responders. And the whole idea is to not only track, but to help this population have targeted mental health services available to them. And so I was actually very happy to see that during the pandemic, it's been decreasing the number of suicides in our first responders. So another population that I think warrants attention are vulnerable populations. And so there are multiple ways to define a vulnerable population. I like this definition, which is more of a research definition, but these are people who are relatively or absolutely incapable of protecting their own interests. More formally, they have some sort of an inefficient or insufficient power, intelligence, education, resources, strength, or needs to protect their own interests. So this includes everybody from the ill, minoritized communities, whether you're talking about racial, ethnic, gender, sexual orientation, non-native English speakers, children, economically disadvantaged, adults with diminished capacity, and pregnant individuals as well. These are all relatively vulnerable populations. But one I wanted to focus on for the relevance of this topic is the transgender as well as gender non-conforming communities. And there are multiple ways to define this. This is from the Human Rights Campaign, which I like their definition. And so using this phrase in this context, we'll refer to transgender and gender nonconforming to be a collective community of individuals whose gender identities, expressions, and or lived experience differ from and may in fact transcend what is typically associated with the sex they are assigned at birth. And unfortunately, 2021 was the deadliest year on record for transgendered people. America. There were far too many anti-trans homicides. In 2021, at least 51 trans Americans were killed. That's up from 44 in 2020, and then up from 27 back in 2019. In 2021, 66% were Black women. And I remember watching the news, and I forget how many of the first, but every single face was that of a Black woman. In 2021, at least 39 were transgender women. The states where they incurred the most, Texas, Pennsylvania, Florida, and Illinois. But as you can see, happened all over the country. And since 2013, 256 trans Americans have been killed. And then 77% of those were women of color. And at least is used because there's so much misgendering of these individuals by the news, sometimes by their family. So it's hard to capture how accurate we are in capturing these deaths and reporting these deaths and speaking for these individuals. This is restating a lot, but 84% overall were people of color. 85% were transgender women. And this is all since 2013, so not just the past year. So conclusions before we get to the question and answer session. So it's a lot to take in. We are all traumatized. I gave a talk not too long ago with someone, and the topic, I did a whole thing on vulnerable populations. And I got to the end and someone asked me a really, heartfelt question of everything seems to be getting worse. What are we supposed to do? And I kind of agree. You look at the numbers, it does seem to be getting worse. I think a practical thing to realize is we're all traumatized, to really engage each other with grace and be patient and recognize you have no idea what anyone else has been going through, what anyone else has lost. What does that translate to? When you're driving, be patient on the road. I used to get a little road rage and get mad, but now, I just let people go because you literally never know how someone's going to act and react. And that might be your life. That might be the life of your child. I've kind of seen it all during the past 2 years, although every time I say that, I see something a little more wild. But yeah, really try to be patient and graceful. When in doubt, just don't say anything and just kind of smile and walk away. Speaking to the natural disasters, I didn't include this, or I don't think I said this, but in a natural disaster, the most vulnerable population, so that list they're the most vulnerable, especially during natural disasters. So be a good neighbor. So if you live somewhere and a hurricane's coming or a heat wave, and you have an elderly neighbor that maybe doesn't have live-in family, be proactive, check on them, make sure they have AC. Now that we're kind of out of the scary time of the pandemic, if they don't, perhaps invite them to shelter with your family. because you could save a life. And a lot of the deaths we saw during heat wave, specifically in Seattle last year, they were elderly. Historically, kids are at increased risks for heat wave related deaths, as are elderly, as those with chronic illness. So if you know you're living around someone that doesn't seem to have that support network, consider being that support network for them. When we talk about the drug use in this country, goodness, I've seen some young deaths. I will say, I'm also not a parent, so take it with a grain of salt, but I don't think it's almost ever too young to have those conversations about drugs with your children. On a more practical note, I was recently talking to a friend of mine in New Orleans who's part-time bartender. I was talking about this presentation and she was saying how wild it's gotten there. And, she's used to, as a bartender, worrying about over serving people with alcohol. And recently she's had a little string of overdoses, which is traumatizing. If you can imagine, you're not expecting to go into your shift dealing with someone dying in your arms. And so I brought up the topic of, do you all have Narcan or naloxone on hand? And, if you have a kid that happens to work in the service industry or know someone, I think it's worth it that we all have these conversations. A lot of people bartend or serve part-time. I've had overdose deaths at, restaurants. It should kind of be everywhere by this point, Narcan. It could really easily save a life. Also, stop traumatizing the staff. And then, for those people that do use, which I doubt it's anyone in this population, but if you know someone, really fentanyl test strips, really helpful, identifying drugs that, have been laced with fentanyl. Sure, some people do seek out these pills that are laced with fentanyl, but a lot of people don't. And then they take them and they die and they had no idea fentanyl was in there. And then I think lastly, before we open it up to questions, I hope this shows how busy we have been as a community, because if you look at each office, we're a small community. There are maybe 400 or 500 of us across the country, right? Each office, some offices are offices of a single person doing all the cases. Even your bigger offices, at most, you might have 5 or 6 people working a day. So if you take this all together, we've just had exponential workload increases. It hasn't stopped. I think a lot of people in healthcare, they had waves where it was super busy and then there was a break. There has been no break for us. So all that to say, I don't know who's listening, but if you're one of those people that you're working with legislation and different protections and resources for healthcare workers, that we are healthcare workers. We desperately need it. We're a profession that already has a fairly high rate of burnout. We see a lot of vicarious trauma, sometimes see the worst in the community. And just to remember us if you're at that bargaining table. And when I say us, it's not only the forensic pathologists, the coroners, but everyone in our office. Our technicians have been working nonstop. Our investigators, good Lord, they work 24/7, in shifts, but they've seen such an exponential increase, and they are deserving of resources too. And that concludes the presentation. So now for questions.
Yes, thank you. That was an excellent talk, as several people in the chat window have already pointed out. If you have questions, please put them into either the chat window or the Q&A function at the bottom, and I'll sort of moderate. I've already got a couple I can ask while we wait for more to come in. The first question, is there any data about excess ethanol related deaths, given that there's been a marked increase in ethanol sales?
That is a good question. I did not specifically look into that. I touched upon it briefly with that study in Michigan. I'm trying to think off the top of my head. I didn't. So I will say ethanol. I've been in a few offices, and the way people approach ethanol related deaths, it's interesting. Some offices, I think it's very regionally dependent. So having gone to med school and residency down in New Orleans and then fellowship in New Mexico, those are 2 populations with incredibly high alcohol rates. Lower out in Washington, and all that to say, I think certain areas you'll see a higher rate of acute ethanol intoxication, where, their levels are over 500, 600, 700, rare in some. And so I think some offices aren't necessarily looking into it. I also, just living through this, I think a lot of people have a lot of things they want to study, and there's just so much limited time. So all that to say, I have not come across that. I wouldn't be surprised if someone somewhere is working on that, but that Michigan study was one of maybe two I saw even really touching upon ethanol. It seems to be slightly overlooked right now, and really unsurprising. I think more people are panicked about, or paying more attention to the opioid crisis, the COVID crisis, the gun violence crisis, but definitely something of worth to study, because ethanol has historically killed us fairly consistently at a high rate for, whether it's job-related accidents, whether it's, complications of chronic ethanol ingestion. So I definitely think it's something worth studying. I just feel like everyone that wants to study something is so busy right now.
Sure, there's just so much data to pour through with everything being the way it is. Moving on, we've got several more questions. So the next one, the trend of rising Black suicides from the start of COVID is obviously troubling. Is there a breakdown of these suicides? Are there trends in age or other demographics or possible explanations for this trend?
So I'll say, and I probably didn't make this explicitly clear, that trend of increasing suicidality in the Black population, that has been going on for a while, at least over a decade. It's been going on a while, and quite frankly, ignored or not given any attention to for a while. So it's actually not new. And I don't know how much the increase seen in certain populations in the US have deviated from historical trends and increases, but what we do know, it did not decrease, which is a problem. But there have been some studies. I'm trying to remember the research group. There's one research group that's kind of at the helm of doing all of this, and studying specifically trends in communities of color. Again, unfortunately, everything I read of, it gets complicated in the US. I think, given our nation's racial history, I think sometimes we focus on just white and Black when there are other communities as well. And I think a lot of what I've seen has been speaking to that. I'm kind of getting sidetracked, sorry. But all that to say, I do think people are, and I need to stop trying to read the chat while I talk. That's not going well. I do think people are studying that. Did I answer that question? I can rant sometimes, I'm sorry.
I certainly think you touched on it, but again,
Okay.
it's a nuanced question, and there's, sometimes the data are there and sometimes there's just other things going on. Moving on, sorry, to the next question, because it sounds like you're keeping an eye on the chat and they're pouring in. One person notes that they are APCP, not forensics, but have found it very difficult to find locum tenens or moonlighting arrangements with MEs through bureaucracy. Is there any need for surge coverage by non-forensic pathologists, and how can pathologists do or provide this in a straightforward way?
Oh, well, so that's an issue, right? So right now, it's like, what's the saying? We're robbing Peter to play Paul. So yes, there is a need for surge coverage. To the best of my knowledge, what is typically happening, there are locums or people doing consulting work for different offices. Almost every office is short-staffed. I even started here. They hired 2 of us to fill in the gap, and already the overdose deaths are so high, we're almost relatively short-staffed again, even though we're up 2 people. And so what is being done right now, and I don't know how sustainable this is, you typically have to be a board certified forensic pathologist to fit in, and people are basically using their vacation or weekends to fly to other offices or drive to other offices to help fill in. But I mean, you're basically using an exhausted population to fill in the gaps. So I don't know how that is. Recently, if you're familiar with DMOR, which is a response team that's usually sent out in response to natural disasters like Hurricane Katrina. When there are these mass casualties, they actually deploy them to one of the nation's offices to just help with their backlog because it was so bad. So that's what we've been doing. I think that's highly problematic. So I think everyone's just exhausted, and I don't know how that's really helping anything. Now, would I love to see, I think, yes, I think it would be great. People are doing, people have experience doing hospital autopsies that are anatomic pathologists. I think all this is above my level, but I don't see why not. It would certainly help us, especially, the more straightforward overdose deaths. But I think these are all above my level of involvement. But right now, I think it's just using tired forensic pathologists to fill in the gaps, which I don't think is sustainable.
Perfect. Thank you for that information. Next question. Where can people in the general community get Narcan? Is it available over the counter? I haven't seen this information shared widely.
That's a good question. I clearly have not looked into it myself. I'm going to Google. I'm sharing my screen. Where can you? I feel like you can just get it at a pharmacy.
So there you
I
go.
want to be right. Yeah, you can just get it from a pharmacy without a prescription. Good. That's how it should be.
I never thought of that either.
Fortunately, all the offices I've been at have had Narcan there, so I've never thought about procuring it. But yes, you can just go to a pharmacy and get it.
Excellent. You may have seen in the chat, someone said, please let Dr. Jackson know the LSU Pathology Department and Dr. Fred Rodriguez are very proud of her.
Oh, thank you all.
Awesome. Back to the Q&A. What are the most striking differences that you have observed between Cook County and King County?
The biggest differences?
Yes,
Did I hear that?
Biggest, most striking, yes.
Well, it's not really a surprise. So nothing's a surprise. You kind of know what you're getting into at each office. So Cook County, we all know the gun violence in Chicago. That's been an issue for decades, years. So a lot of homicides there. What I didn't anticipate going there, so people don't talk about it, there were far more overdose deaths than there were homicides. And so even on a busy day where you had, some party, or goodness, during the pandemic, it was people going and like shooting up memorial services. And so you'd have multiple people that were killed with gun-related violence. You would still, for every pathologist that was on, you would have 1 to 3 overdose deaths. And then sometimes we would have another pathologist on just doing overdose deaths. And no one really talked about that. And that's a lot because you have 5 or 6 doctors on. I mean, that's a lot of overdose deaths per day. I fully anticipated going to King County to see a lot of overdose deaths, which we do see. I will say very recently, the past few weeks, there seemed to have been a ton. That wasn't surprising to me. That was kind of anticipated with the move. What else? I think switching to King County. So King County is housed under the King County Department of Public Health. And I don't think I realized how nice it is to be nestled under a department that gets what you do, appreciates what you do from a public health perspective, is supportive of what you do, is supportive of initiatives that, are helping to assess things in real time, whether that's COVID. We have a whole COVID surveillance team, these interns, and they are funded by the county, and they went out during the entire pandemic to swab everyone they could at funeral homes so we can get an accurate read of how prevalent COVID was and how it was spreading, whether or not people died of it or not. And just having that support versus being housed under, just the general government and fighting more for different things.
Excellent. Okay, speaking of, overdose deaths, someone asks, how can we reduce the availability of fentanyl?
Oh, I don't know that we can. I mean, you're
lofty
fighting.
Question.
You're fighting. I don't know. How do you fight the Mexican drug cartel? I don't know. I really don't know.
Hopefully someone has an answer, but right. It's a very, very challenging question. Detail. That's an hour-long talk in itself, probably.
Oh, easy. And they're not the only drug cartel getting fentanyl into the US.
Next question. In Virginia, we have seen a big increase in fatal drug overdoses among Black males and Black females in 20 and 21. The rate of Black males actually surpassed white males, the longstanding highest, in 2019, and the magnitude of difference is growing even more. Any ideas why fatal drug overdoses are affecting the Black community with more so recently than ever before?
Yeah, so I almost included that. There are multiple cities that are reporting that, or states. I mean, the logical conclusion is, I didn't get into this because I didn't want this to be the focus of the talk, but we look at the communities of color, specifically the Black community, Latino community, Indigenous community, bearing so much of the brunt, right, of cases of deaths, but then also housing insecurity, of job losses. And I mean, it's just attack on your community, the police involved killings of, people, it's studied, it's traumatic when we watch us, and, people looking for an escape. And I'm not surprised it coincided with the pandemic. Sorry, I just got a notification. Did I lose people? Uh-oh.
Sorry, I had a bit of a glitch on my end.
I think it was my end too. I got a notification my internet was unstable.
Oh boy, well, in that case, maybe it's good we've only got a couple more minutes. I think we can fit in one or two more questions.
Oh, did the rest of my answer come through? I don't know, I'm not sure.
I didn't hear it, I don't know if anyone else did, but if you want to repeat the last maybe 2 or 3 sentences, that might help, just in case.
Yeah, I don't know where it cut off, but I basically said, I mean, it's really unsurprising that, a pandemic where you're seeing so many people that look like you, people dying left and right, whether it's from COVID, whether it's from police, whether it's from what have you, suicide, that people would turn to drugs as sort of an escape. That's not surprising to me.
That makes sense. Last question, a practical question. Easy access to Narcan is one way to reduce overdose deaths from heroin and fentanyl. With methamphetamine on the rise, is there any preventive measures for those ODs?
Oh, goodness. My opinion, no. I'm not a toxicology expert, but goodness, the meth deaths, and, there's, I don't know, I feel like between New Mexico, basically New Mexico, I feel like I have so much experience with seeing how meth kills, because you have the methamphetamine overdose, which honestly, usually it's not in isolation. It's usually methamphetamine plus fentanyl, but sometimes it is just methamphetamine. But, when you see those hearts of people on chronic meth, and, they're in their late 20s, early 30s, and their hearts are huge, 800 grams plus. I mean, that heart is so strained. But then I've also seen other ways meth can kill you, just someone being on meth and being, in a psychotic state. So I don't know, that's a terrifying drug to me, more so than many other.
Well, it is at 2 o'clock, so I think we should cut it off. You're getting more supportive comments in the chat, so make sure you don't miss those. But on behalf of the entire VPGR group, thank you so much, Dr. Jackson, for this excellent talk. Thank you for joining us today.
All right, thank you for having me, and thanks for coming out, everyone.
Bye, everyone. And someone asked, but this will be recorded and this is available to view on YouTube. All of our lectures are. This will be up after the time it takes to edit and so forth.
All right.
All right. Take care, everyone. Bye.